We designed this space specifically to be able to perform very complex surgeries and still allow patients to transition home the same day of their procedure.
Patients don't have to seek treatment to go to Nashville or to go north, that they can come to a destination where we'll have top-notch surgical care, surgeons, nurses, surgical techs, physical therapy, all under one roof.
I think it gives us an opportunity to be able to deliver the highest quality health care in a beautiful new facility with state-of-the-art equipment, and gives patients the confidence that they can come here and be taken care of well. And that we can offer really everything that they would need, certainly in the spectrum of orthopedic care right here in Maury County.
We've committed to excellence in this community for a long time, and Maury's committed a lot of resources here. They've got a 5-star facility, and it's going to deliver 5-star care.
We're going to do sports medicine procedures, total hips and total knee, shoulder procedures. We'll also do hands and wrist procedures. Foot and ankle surgeries will be done here.
Mako and robotic surgery in general has been a big change, to orthopedic practice in general, certainly for us. And that starts with the CT scan they get preoperatively, allows us to build a virtual 3D model of whether it's their hip or knee or what body part we're working on.
No one patient is the same, which means no one joint is the same. And so we're able to tailor those techniques and those surgical outcomes to you specifically.
It just allows us to take what we're already doing and execute it at a higher level, with the goal being to improve outcome and shorten recovery time.
I think one of the great things about the orthopedic staff here at Maury is that we are all very, very technically good surgeons and also good friends. I've seen the orthopedic program grow into really one of the elite programs in the state. It does mean a lot that the hospital's committed these resources to the community, but also for our group to have this facility to operate in.
One of the things that we have to always consider is the growth of our community, but also the growth that will come with our aging population. We anticipate that between now and 2030, there will be an increase in total hip and total knee replacements of about 44% within our service area. That was instrumental in influencing our decision to invest a significant amount of our resources into building this incredible new experience for patients in Maury County and southern Middle Tennessee.